these days, I would highly recommend, if you're getting older, especially if you're over the age of 80 or 70 or whenever you think is appropriate, definitely over the age of 80, do you have a doctor that you can fully trust and rely on, and to be able to communicate with them easily, and will the office get the information to them the way that you need? And if you're not getting that from your doctor, and this is becoming more and more of a problem in our healthcare system, just there's so much more red tape these days. Doctors are completely overwhelmed with too much volume of patients coming in. And so there has to be different models in healthcare. And the good news is these models do exist. So there's concierge doctors and there's also direct pay doctors. And what you might find is find one in your local area and call them up and see what the difference is. How do they handle working with their clients that might be different from a traditional doctor that you might be used to? Now, if you're already working with a concierge doctor, here's the other thing, or direct pay doctor, utilize them the best you can. Usually you're able to reach out to them quite easily. So make sure that you're doing that. Don't hold back. Make sure that if there is something wrong, you're taking action and you're fully utilizing the services of a direct pay or concierge doctor. Very, very important. And this is how you get ahead on things. Now, think of it. One ER visit can completely change everything. Just the cost of the ER visit itself can be the cost of a concierge doctor or direct pay doctor. So look into it and see if it's the right fit for you. It might be something that you want to take advantage of, because being proactive on the medical side is one of the best things you can do to prevent yourself from going to the hospital and going to a nursing home. Other team members that you might think of course, are caregivers. And I usually recommend that people take a lot of time to screen out and look into a caregiver or a caregiving service, because the caregiver can really make or break a situation. This is the individual that's going to be on the ground with your aging loved one, usually all day, every day, or at least a large chunk of time, and taking care of them and their needs. So you want to make sure that you find the right person or persons, and don't be afraid to, try one out and then move on to another one if it's not the right fit, or make sure that you're interviewing people properly. Don't just accept, well, this is just how it is, if you're not happy with the service, because that person is going to be a big factor in how well your aging loved one is either advancing and progressing and improving versus are they declining. And yes, the caregiver has a large part to do with this. Find the right caregiver for your needs, but also who's the person that's going to connect the most with the person who's being taken care of, whether it's your parent or neighbor or grandmother, who is going to connect with the person that you care about the most. And so finding that person that's going to connect with them can also just make a big difference. It might be just a personality change that needs to happen, and that's okay. It's okay to make that type of a switch, because the person who's able to engage with your aging loved one is the person that's going to make a big difference, because they're the boots on the ground, usually day in, day out.